Today is the 1 year anniversary of the first case of COVID-19 being confirmed in Canada, though at the time it didn't really carry that name. And one of the most disturbing things about COVID-19 is that it's very hard to pin down. We've got the asymptomatic carriers and something called long haulers. Now, a lot of people are like, well, I'm not worried about getting COVID-19. I don't understand that whole way of thinking, that viewpoint, but they're not worried about it because they figure they're healthy and it's not going to affect them too much and they're relatively young. Well, enter this 48-year-old who is now 48-year-old rather, who is now, she's launched a lawsuit because her insurer for her, that her employer has the insurance with, is rejecting her disability claim. This is for long-term disability insurance. And I just want to give you a little insight before we welcome Nainesh Kotak onto the show about this woman's story. She was a communications manager. She's 48. She lives just outside of Ottawa, and she contracted COVID-19 in March during the first wave from her construction worker husband. Now, according to the CBC, she continued working until early June when she came down with a more severe set of symptoms, including debilitating fatigue, shortness of breath, racing heartbeat. She says that for 7 weeks, when her illness was at the worst, for 7 weeks, think about that. She said she thought she'd die in her bed, and her husband also developed many of the same symptoms. It's leaving them both unable to work. They are what is called long haulers. Now, here's the problem. Unlike the UK, Canada has yet to establish federal guidelines recognizing and defining long COVID. So she is now becoming one of a bunch of people that are being, unfortunately, lost in this pandemic. They're not being supported. And she says after months of struggling with symptoms, due to this extended long haul of having COVID, she is now looking at the prospect of having to sell her home to pay her bills because she just can't work. And her long-term disability claim was rejected by her employer's insurance company. So she also can't access federal COVID-19 support programs because they don't acknowledge the condition. So here's Nainesh Kotak. He's the lawyer and founder of Kotak Law to join the program to talk about it. Nainesh, this story, it is a cautionary tale because there's a lot of people that may not be affected severely by COVID immediately, but we're now finding out they could have lasting symptoms.
Exactly, Kelly. I guess the medical name for this is chronic COVID syndrome. And conditions that, the symptoms that are coming back after a few months or even staying with people, you've got fatigue, shortness of breath, as this woman had, joint pain, sometimes organ damage, and there is some research being done about it, as you said, more in the UK. There's a project in Ottawa that's dealing with it, and out in Alberta, they have some guidelines as well. So, of course, because, COVID's sort of been around in Canada 12 months, everything is sort of new for us, and we're really obviously playing catch-up. Some people say there's an autoimmune component. If people have autoimmune disorder to begin with, maybe they're more susceptible to having this long-haul COVID. Really hard to tell, but it's very unfortunate because we do know it exists. I have cases as well where insurance companies are not paying on it. And it puts people really in a catch-22 because, you ask the question, okay, what do I do then if I've got this? Well, first of all, you try to get the best medical attention as possible, and very difficult to do during COVID because many family doctors are just simply not seeing patients, so it has to be done online. But the next thing is, how do you deal with an insurance company who's not recognizing it as being a valid diagnosis to cause a disability? And unfortunately for this woman and for many others, they're in that boat, and where they're left with the situation. Okay, well, we have to sue now our disability insurer, and that that can take some time. In the meantime, how do I keep my house? How do I access some therapies that may cost money? It's very unfortunate. I think very important for people if to understand that yes, it's a small subset of the population that seems to be having chronic conditions after COVID. But But some researchers are saying it could be even up to 10% of people who contract COVID who may actually fall in this category. They define it as looking at, if you still have symptoms after 30 days. And unfortunately for this woman, obviously now we're looking many, many months later. And Kelly, your heart goes out to people, but we just have to be so careful on the one hand as a society to say, look, this, until the vaccination process really takes hold, we're all in, there's some danger here. You could be otherwise very healthy, and it's unknown really as to why a particular person would have the long effects. But in terms of what to do with disability insurers, unfortunately, it would be suing them and then producing medical evidence, research and medical evidence from one's own treating doctors, from one's own counselors, because obviously there's an anxiety component that's going to occur when you're anxious about where's my next breath going to come from, or am I going to get good night's sleep again? So counseling obviously is very important. Getting the notes of those counselors is going to be crucial to present to the insurance company to say, hey, look, I've got these symptoms, and these are confirmed by my treating practitioners.
So what are you advising? Are you advising people that have had COVID to make sure that they're, recording Zoom calls with their doctors, that they're getting notes saying that the doctors are saying, yeah, your symptoms are continuing? Because until Canada establishes federal guidelines recognizing that long COVID actually is something that people are suffering from, aren't these kind of unwinnable cases?
No, I wouldn't say they're unwinnable, because at the end of the day, look, if you do visit the doctor in some way, whether it's by Zoom, whether some doctors are actually seeing people, whether it's through counseling, then a record would be made of the symptoms. Look, most people, after 3 weeks they recover, and it's just a bad episode, right? But for the others, that small subset, it continues. Yes, very important that they do report those symptoms to treating doctors, because the doctors make notes. Every time you have a visit, whether it's on Zoom or in person, they make clinical notes of what you have said and what your symptoms are, and they send you for appropriate tests. So, if you have that medical backing behind you, it's certainly not an unwinnable case. But you can prove your symptoms, whether it's the respiratory issues, whether it's psychological issues. You can prove that you have those symptoms. Maybe they're going to say, well, we don't believe long COVID exists, or whatever they're going to say, but that doesn't matter. At the end of the day, if you have those symptoms and you have something that is evidence-based, you can get reports to show that, no, wait a minute, I cannot work because of my disability.
Right.
And you should be successful if the case is put forth in a proper way. First step, obviously, is get the right medical attention, assuming that you do have the long symptoms.
So one of the things, Nainesh, that I want to touch on is that short-term disability doesn't seem to be affected in most of these lawsuits. It's the long-term disability. So are you finding that insurers seem to be, honoring short-term disability applications?
Okay, so this is the thing. Many short-term disability policies are administered by an insurance company, but paid by the employer. Sometimes the insurance company pays, but a lot of times they're paid by the employer. So usually when you get a denial for long-term, you've got a denial for short-term as well. They kind of go hand in hand, because it's the same insurance company usually that's making the decision, irrespective of who's paying it, which would be the employer. In what people do in that situation is they have to sue the employer to pay the short term, and usually the employers, it's usually 16 weeks or so. They're going to say, okay, well, we just want out of this, and we'll pay this if you're off work legitimately. The bigger battle is with the long-term disability care, getting that money, because many policies pay for extended periods of time, sometimes up to age 65. But I do find that when they do go hand in hand quite a bit. You'll get the short-term denial, and then they'll tell you, well, hey, you're not even eligible for long-term disability because you didn't get approved for short-term. So I think that they do go together.
Nainesh, thanks so much for joining us. I always appreciate you sparing some time for us.
You're very welcome. Take care.
Have a great day. Nainesh Kotak, a lawyer and founder of Kotak Law.